Hello, my name is Mauro Murillo, and today I'll be talking about muscular dystrophy. Muscular dystrophy is a group of different types of diseases that damage and weaken muscles over a period of time. This condition is due to the lack of protein called dystrophin, which is needed for normal muscle function. There are currently over 30 different types of muscular dystrophies, and they're divided into 9 separate categories. These types of muscular dystrophies vary in symptoms and can be detected from early childhood to adulthood. Duchenne muscular dystrophy is a common type of muscular dystrophy mostly found in boys. Symptoms include loss of reflexes, difficulty standing, issues walking, leg and heart weakness, and trouble swallowing. These symptoms are apparent between the ages of 2 and 6. Most need a wheelchair by their early teens. The normal lifespan for people with Duchenne is late teens or 20s. Becker muscular dystrophy, similar to Duchenne, is less severe and also mostly affects boys. Symptoms usually appear around the ages of 2 and 11, but they can progress slowly as well, so there are times where they won't appear till the age of 25. Some of the symptoms include frequent falls, muscle cramps, and trouble getting up on their own. Many tend to need a wheelchair by the age of 30, and there's a small percentage who don't need one at all. Most people with the disease live till their middle age or older. Congenital muscular dystrophy is present at birth by the age of 2. Parents are able to notice that the child's motor skills and functions aren't developing properly. Symptoms vary and include muscle weakness, poor motor skills, scoliosis, respiratory vision problems, speech issues, and intellectual impairment. Majority of people with congenital muscular dystrophy aren't able to stand or sit without assistance. Due to variations in symptoms from being mild to severe, some with congenital die at infancy, while others live until their adulthood. Myotonic muscular dystrophy, also called Stein disease or dystrophia myotonica, is a type of muscular dystrophy most common among adults, affecting both genders. In some rare cases, it could appear in newborns. This is then called congenital myotonic muscular dystrophy. This causes a myotonica, a symptom exclusive to this muscular dystrophy that does not allow the muscles to relax after they contract. Symptoms include muscle weakness, difficulty lifting one's neck, weight loss, increased sweating, and difficulty swallowing. It is also known to have an effect on the respiratory system, heart, and gastrointestinal tract. Most are diagnosed at their 20s or 30s. People with myotonic muscular dystrophy usually live a long life. Oculofacial muscular dystrophy causes weakness in the facial, neck, and shoulder muscles. It is diagnosed in male and females between the ages of 40 and 60. Symptoms include drooping eyes, trouble swallowing, changes in the voice, difficulty walking, and problems with their heart and vision. Facioscapulohumeral muscular dystrophy, also known as Andaussy-Dejerine disease, is a type of muscular dystrophy that affects a person's face, shoulders, and upper arm muscles. Symptoms include usually having problems with walking, speaking, chewing, or swallowing. It is diagnosed at early teens to adulthood, but there are times that the symptoms won't appear until the age of 40 due to them being progressively slow. People with facioscapulohumeral tend to live a long lifetime. Limb-girdle muscular dystrophy causes muscle weakness and loss of muscle bulk. It usually starts at the hips and moves along to the legs, shoulders, and arms. Those who have limb-girdle tend to have trouble getting out of chairs, walking up or down stairs, and carrying heavy objects. Most people diagnosed with the type of muscular dystrophy are disabled by the age of 20. Despite that, many tend to live a normal lifespan. Distal muscular dystrophy, also called distal myopathy, affects the muscles found in one's forearms, hands, calves, and feet. There are some cases where it can also have an effect on a person's heart muscle and respiratory systems. It is known to be less severe, progressively slower, and affects fewer muscles than other types of muscular dystrophies. Most people diagnosed with distal are between the ages of 40 and 60. Emery-Dreifuss muscular dystrophy is a rare form of muscular dystrophy that appears from childhood to early teens. It usually results with muscular weakness in the shoulders, upper arms, and lower legs. People with Emery-Dreifuss are known to have life-threatening heart problems. Most people with Emery-Dreifuss tend to die at mid-adulthood due to heart or lung failure. There are different types of tests that can be used to determine whether a person has a form of muscular dystrophy. For example, a doctor can give a blood test to check for enzymes released from damaged tissues, a genetic markers test, or a muscle biopsy. They could also perform an electromyography, an EGM, to check the muscle's electric activity, or an electrocardiography, an ECG, to check the heart's electric activity. As of right now, there's no real cure for muscular dystrophy. There are treatments out there, but those treatments are more focused on overcoming the symptoms and the disease itself. For example, some people take corticosteroid drugs, some have assisted ventilation, others undergo surgery, and some go to physical or occupational therapy. Thank you for taking your time and watching this video, and hopefully it gave you more information that you didn't know about muscular dystrophy. Thank you for watching.